Hello, I'm Dr. Craig Escude. Welcome to Medical Monday. All right, we're talking about different behaviors and what they might be indicating from a medical standpoint. So, headbanging. If you've worked in the field of providing supports for people with intellectual and developmental disabilities, especially if you're working with people that have more significant levels of disability, you likely have seen head banging type behavior, head hitting, head slapping, face slapping type behaviors. These can indicate a number of things. Some of the things we should think about, though, is first, the obvious, head pain. Is there something that's causing pain in that person's head? So, when we try to think about potential causes, I think about every hole in your head. So, could it be an earache? Could it be ear pain and the person is hitting it because they're trying to hit at that pain? Could it be dental pain? They're hitting at their mouth, their cheek, oral pain, an ulcer, a dental abscess. Could it be eye pain? Could it be something in their eye? Could it be conjunctivitis, pink eye? Could it be glaucoma, which can certainly cause eye pain? And if a person can't tell you exactly what they're feeling, that might be the only way that they can show it to you. Here's one that we have to always think about is, could it be sinusitis? Could this person have a very bad sinus infection in their frontal sinuses or their maxillary sinuses that's causing a lot of pain and a lot of discomfort? And so they're hitting themselves to try to relieve that pain or to indicate that that's where the pain is. So think about those things. But people with disabilities might hit themselves not only because of head pain. We have something that we see that we call kind of a go-to behavior. It's the thing that we go to often. Some of us, when we get stressed, we go to an eating behavior and we overeat. Well, sometimes people with disabilities have learned or have a go-to behavior in the sense that anytime there's some sort of discomfort, it could be physical. For instance, they could have foot pain and still hit their head because that's just what they do to indicate that they're in pain. But it could also be some other stressor. It could be some environmental cause. It could be a situation that they don't want to be in. Maybe the room is noisy and they don't want to be there. So this is the way that they indicate, dislike for something. It could be that there's a roommate or a person they don't get along with. It could be that they don't like the meal. It should be thought of as a way to communicate. That head banging, that head slapping behavior is a way to communicate something else, usually. And we, as supporters of people with disabilities, should always be looking for treatable or fixable, resolvable causes, rather than just saying, oh, they're just doing that simply because they have a disability. Or even worse, oh, they're doing this a lot. Let's put them on a medication to see if we can reduce that behavior. When in actuality, it could be because of some underlying pain, and that person is still suffering with that pain, and we're not treating it because we're misinterpreting what we think is happening. So be aware that head banging, head slapping type behavior can be from some treatable and fixable cause. So look for those. Join us next time.